Hello everyone, my name is Loven Benga, and today I'll be talking to you about my data analytic project for Data 670, which is taught by Dr. Makebe. And my analysis is based on hospital readmission and mortality rate among older adults aged 45 to 95 in the United States. So, this analysis is aimed at investigating hospital readmission and mortality rate among patients 45 to 95 with heart failure diseases due to diabetes, and also identifying the factors that contribute to high readmission and mortality, which can help healthcare provider intervene and come up with a better initiative to improve patient outcome. So, the importance of my project is classified into three factors. One, healthcare impact. Um, Diabetes is one of the leading cause of hospitalization among adults, which result in high healthcare costs and mortality. And the next one is relevance to current effort. So this project is relevant to current initiative as far as healthcare management is concerned for readmission and readmission due to diabetes. And the potential benefit is to uncover factors that are associated with high readmission rate and aim to reduce mortality in this age group. So on the next slide, on this slide, we will be talking about the different KPIs for this project. So we have four KPIs for this project. The first one is project completion, which align with the deadline, ensuring that there is a timely project completion. And then the next one, we have the model effectiveness, which measure the metrics like accuracy and AUC. The next one we're talking about organization impact through which reduce readmission rate. And then the next one we're talking about the stakeholder satisfaction, where we make sure we get in at least 80% and higher satisfaction rate. And on our next slide, we'll be describing the data. So my data was gotten from Kaggle, where I used two data sets from Kaggle. The first is the hospital readmission data set, which is made up of 25,000 records from 130 US hospital, which have columns such as age, gender, diagnosis, hospital readmission duration, patient status, discharge, and this data has no missing value. And these are the columns you can see right here. These are the data. This is the data. And the next data set is the heart failure clinical data set, which is made up of 299 observations from clinical trials and hospital readmission. And it is made up of 5 continuous and 8 categorical features in this data set. It also has no missing data. And some of the columns, we have age, anemia, treating, diabetics, blood pressure. While you can see that the age in this data set is numeric, that of um, hospital readmission is categorical, just to point that out. And this is one of the reasons I face difficulty while merging the data. So the strategy I use to analyze this data, I use strategy. I use logistic regression, which is suitable for relationship between dependent and independent variable. I use decision tree, which help to interpret, which helps to predict data by splitting. I use random forest, which helps to predict data by combining multiple decision tree. I also use evaluation metrics such as accuracy, precision, recall, and the tool I used for my data visualization was Python, Arrow, Tableau, and Power BI. Um, Below you can see my visualization. So my pie chart shows that um, the black tells you if the black tells you the percentage of people who were readmitted, and then the yellow tells you the percentage of people who weren't readmitted. So from this pie chart, we can see that 52.98% of people were not readmitted, while 47.02% of people were readmitted. And then in the next slide, we can see it talks about the emergency occurrence by age group. So in this chart, we can see that the age group 50 to 65 are those that often visit emergency. You can see a higher rate of 1,022 record, and this could be either due to their lifestyle, and this help to increase heart failure. So in this slide, we talk about diabetes condition by age and gender. Looking at this diagram, you can see that male the number of male that that is being affected by diabetes is really high, and this could be either due to the lifestyle, and we this analysis figure out ways in which we can reduce readmission and mortality in this group. So yeah, we talk about the um we review our models. Three models were used, which I already mentioned, which is logistic regression, which is good for understanding relationship between the variables. We have decision tree, which is good to interpret the variables, and then we have random forest, which helps to combine multiple decision trees. And for our champion model, the gradient boosting classifier is the highest with accuracy of 0.614 and sensitivity of 0.74. So we can see that this is suitable for predicting healthcare um, analysis. So here you can see a success rate right here. And then for the findings, Uh, I realized that age, readmission frequency and a significant predictor of mortality, and this help to support the target. So the insight I get from this help to support the targeted care with high risk patient group, which in our case, we can see that that is mostly male. And we can also see that is the age group 50 to between 50 to 60. So yeah, you can see that the patient with a higher frequency of inpatient visit have a greater likelihood of being readmitted. So the recommendation I would give for this analysis is to make sure that hospitals implement a follow-up care for high-risk patients. They also allocate resources for chronic condition management post-discharge, and then they also help to improve discharge plan in by minimizing unnecessary readmissions. And the next step, I think I missed one. Okay, so the lesson learned throughout this project, some of the things I learned is that uh so some of the things I learned is that in order for my analysis to be successful, we have to have good quality data. So the data has to be well cleaned, no missing data. We have to get a proper model selection. The data set, you we have to be able to merge the data set and also get feedback from the stakeholder in order to make sure that the project align with the healthcare objectives. Um, the next step for my project is to make sure that I present my project to the stakeholders and gather their feedbacks, and this will help to implement the project successfully. So below are my references. This is the end of my project. Thank you so much. I look forward to answering any question as far as this project is concerned. Thank you.